Human papillomavirus, commonly known as HPV, is one of the most widespread sexually transmitted infections in the world today. Human papillomavirus, commonly known as HPV, is one of the most widespread and misunderstood viral infections affecting humans today. Despite being extremely common, HPV often remains invisible, silent, and undetected for years, sometimes even decades. Many people live with the virus without ever realizing they are infected. Yet behind this silence lies a serious public health concern, as certain types of HPV are directly linked to life-threatening cancers and long-term health complications. In today's world, where conversations about health are becoming more open and informed, understanding HPV is not just important, it is essential. HPV does not discriminate based on gender, age, social status, or geography. It affects both men and women across all regions of the world, including developed and developing countries alike. According to global health organizations, the majority of sexually active individuals will contract at least one type of HPV at some point in their lives. For many, the virus clears naturally. For others, it can persist and lead to serious disease. One of the most dangerous aspects of HPV is that it often shows no immediate symptoms. Unlike some infections that cause obvious pain or visible illness, HPV can quietly remain in the body, slowly causing cellular changes that may eventually develop into cancer. This silent progression makes HPV particularly dangerous because people may unknowingly transmit the virus to others or delay seeking medical attention until advanced stages of disease appear. HPV is not a single virus, but a group of more than 200 related viruses. These types are categorized into low-risk and high-risk strains. Low-risk HPV types may cause skin warts or genital warts, which, although uncomfortable and distressing, are usually not life-threatening. High-risk HPV types, however, are a different matter entirely. Certain high-risk strains, particularly HPV types 16 and 18, are responsible for the majority of HPV-related cancers worldwide. Cervical cancer is the most well-known disease linked to HPV, and nearly all cases of cervical cancer are caused by persistent HPV infection. However, HPV is not limited to cervical cancer alone. It is also associated with cancers of the throat, mouth, tongue, tonsils, anus, penis, vulva, and vagina. In recent years, HPV-related throat cancers have increased significantly, especially among men, highlighting the importance of awareness beyond women's health alone. Another reason HPV is often misunderstood is the way it spreads. HPV is transmitted primarily through intimate skin-to-skin contact, not just through penetrative sexual intercourse. This means that even individuals who believe they are practicing safe sex may still be at risk if they are not properly informed. Condoms significantly reduce the risk of transmission, but they do not offer complete protection, as HPV can infect areas not covered by a condom. The emotional and psychological impact of an HPV diagnosis should not be underestimated. Many people experience fear, shame, confusion, or anxiety upon learning they have HPV, often due to social stigma and misinformation. It is important to emphasize that HPV infection is extremely common and does not reflect a person's morality, cleanliness, or character. Education and open discussion are key to reducing stigma and encouraging people to seek testing, vaccination, and treatment when necessary. One of the most hopeful aspects of the HPV story is prevention. Modern medicine has made remarkable progress in reducing the burden of HPV-related diseases. HPV vaccines are safe, effective, and capable of preventing the majority of infections caused by low-risk and high-risk HPV types. These vaccines are most effective when given before exposure to the virus, which is why many countries recommend vaccination during early adolescence. However, adults can also benefit from vaccination, depending on age and individual circumstances. Screening is another powerful tool in the fight against HPV. Regular cervical screening tests, such as Pap smears and HPV DNA tests, allow doctors to detect abnormal cell changes long before cancer develops. Early detection saves lives. Unfortunately, in many parts of the world, lack of access to screening and awareness leads to late diagnoses and preventable deaths. Public education plays a crucial role in closing this gap. Men are often left out of conversations about HPV, yet they play a significant role in both transmission and disease burden. While there is no routine HPV screening test for men in most countries, men can still develop HPV-related cancers and genital warts. Vaccinating boys and educating men about HPV is essential for comprehensive prevention and for protecting future generations. Cultural silence surrounding sexual health further complicates the issue. In many societies, discussions about sexually transmitted infections are considered taboo. This silence allows misinformation to spread and prevents people from seeking help. YouTube and digital platforms have become powerful tools to break this silence by providing accurate, accessible, and judgment-free health information to millions of viewers worldwide. Understanding HPV also requires separating myths from facts. HPV is not caused by poor hygiene. It is not a punishment for sexual activity. It does not mean someone has been unfaithful. In many cases, the virus can remain dormant for years, making it impossible to determine when or from whom it was acquired. These facts are crucial for maintaining trust in relationships and reducing unnecessary blame. From a global health perspective, HPV represents both a challenge and an opportunity. The challenge lies in its widespread nature, silent progression, and association with cancer. The opportunity lies in the fact that HPV-related cancers are among the most preventable cancers in the world. With proper vaccination, screening, education, and access to health care, millions of lives can be saved. In low and middle-income countries, cervical cancer remains one of the leading causes of cancer-related deaths among women. This is not due to lack of medical knowledge, but rather unequal access to prevention and treatment. Raising awareness through platforms like YouTube can help bridge this gap by empowering individuals with knowledge that encourages proactive health decisions. It is also important to recognize that HPV research continues to evolve. Scientists are constantly studying new treatment methods, improved vaccines, and better screening technologies. While there is currently no cure that completely eliminates HPV from the body once established, medical advancements have made it possible to manage the virus effectively and prevent its most severe outcomes. Education is the foundation of prevention. When people understand how HPV spreads, how common it is, and how it can be prevented, they are more likely to take responsible steps to protect themselves and others. Knowledge reduces fear. Awareness saves lives. This video aims to provide clear, accurate, and compassionate information about HPV. Whether you are a student, parent, healthcare worker, or simply someone seeking to learn more about your health, understanding HPV is a powerful step toward protecting yourself and your community. Throughout this presentation, we will explore what HPV is, how it affects the body, who is at risk, how it spreads, and why it is considered one of the most significant public health issues of our time. We will also discuss prevention strategies, vaccination, screening, and the importance of early detection. Most importantly, this video seeks to remind viewers that HPV is not something to fear, but something to understand. With the right information and proactive healthcare choices, HPV-related diseases can be prevented, controlled, and ultimately reduced worldwide. By the end of this video, you will have a clearer understanding of HPV and the steps you can take to protect yourself and those you care about. Awareness is the first step. Prevention is the next. Together, informed individuals can create healthier communities and a future where HPV-related cancers become rare rather than common.